Hi, this is Dr. Martin, and in this video I will talk about the muscles of the head and neck. And we need to study those group of muscles in three different divisions. One of them is the fascial expression muscle. Basically, I will talk about it today in this video. They are the muscles allows us to express our feelings like anger, smiling, laughing, depression, etc. And another group of muscles, the mastication muscles, which they help the chewing. And the third group of muscles that allows the movement of the head and neck. Now, when we start the facial expression muscles, first muscle I want to start is epicranial muscle, and frontal belly, anterior belly of the epicranial muscle we call frontalis. It raise the or pull the eyebrow up. And when we look in the back, you see the occipitalis, that is the dorsal belly or posterior belly of epicranius, and they both connected with the aponeurosis, thick aponeurosis. We call this galea aponeurotica or epicranial aponeurosis. We have two circular muscle and covers the circular muscle that surrounds the eye, and we call Orbicularis Oculi, and muscles that circles the mouth we call Orbicularis oris. They are like sphincter, they close. And when we are talking about Orbicularis oris, they close the lips, they close it and they purse it. That's why we call them kissing muscle, because when we're kissing, we have to use the Orbicularis oris. When we look at the Orbicularis oculi, there's superficial and there's superficial and deeper layers. We use them for squinting and blinking. Remember frontalis, when you surprise, you raise the eyebrow, you use frontalis, but when you close, you use the Orbicularis oculi. Actually, there's other muscle we call levator oculi, and that is, or levator palpebrae, and it opens the eye. So Orbicularis oculi closes like squinting or blinking. It doesn't open it. And we talk about the Orbicularis oris, we talk about the Orbicularis oculi. Now let's talk about the muscles here. We call zygomatic minor, zygomatic major. You see, this is thinner than the bigger one here. This is major, this is minor. Zygomaticus, because they attach to the zygomatic bone. And at the same time, there is another attachment that they inserted here to the corner of the mouth in both sides. So when they contracted, they will pull the angle up and allows you to smile. So zygomaticus, minor and major, moves the angle of the mouth upward and backward, and it's like, that's why we use when we are smiling. So smiling muscles. But here there's another muscle we call rhizorius. Rhizorius attached to the inserted to the angle of the mouth, but you see it's horizontal. When they contracted, they pull on to the sides. So it's like a sardonical or greenness. When you green and sardonical smile, you can do with the rhizorius. And of course, you have here the mentalis. It's a small muscle. It protrudes the lower lip. And you have here a depressor muscle that depress the angle of the mouth. And here I want to mention the nasalis muscle. Nasalis muscle. We use them when we do forced inhalation. Forced inhalation and exhalation. That's it for facial expression muscle as of now that I want to mention it. Have a good day.